resources and connect Black women scholars writing and working on African politics. My name is Daquan Lawrence, and I am a doctoral student at Howard University's African Studies Department, and I have the privilege of introducing our esteemed speakers today. Firstly, I'll begin with Dr. Robin Turner, who is a co-founder of the Transnational Black Women Scholars of African Politics Research Network, and associate professor of political science, chair of the Department of Political Science, and director of Peace and Conflict Studies program at Butler University in the United States. Her research, writing, and speaking spans multiple fields, including political science, gender studies, African studies, as well as developmental studies. Next, we will have Mahder Serekberhan, who is a political science student, excuse me for the pronunciation, and graduate student enrolled in Syracuse University's Maxwell School. She received her master's in Pan-African Studies in 2021. She currently serves as a board member on the Africa Initiative, and her research interests include politics in the Horn of Africa, social and women's rights movements, grassroots mobilization and political organization, as well as African transformational and emancipatory politics. Next, we will hear from Dr. Francois Cromer, who is an assistant professor of politics and global studies at St. Elizabeth University in Morristown, New Jersey, where she teaches American studies, global studies, African history, African American history, women's history, as well as comparative politics and general education and first-year seminar courses. Her research focuses on Black women's health, alternative approaches to health and wellness, public policy, political participation, social movements, resistance, and the Black radical tradition. Lastly, our discussant for our session will be Dr. Sophia Farrole, who is an assistant professor at Portland State University. Broadly speaking, her interests include local politics and democracy and citizen party linkages in sub-Saharan Africa. Most of her current work is focused on South Africa, but she has also published papers on Uganda and Somalia. And without further ado, I will now pass it to Dr. Turner so she can begin her remarks. Thank you.
So hello, everyone. Good afternoon. And I'm excited to see each of you this afternoon. What I'm going to do is to present a brief account of my experiences as an African-American woman who studies Southern African politics, with the aim being to provide a lens into how our identities, research praxis, and institutional location shape our scholarship. And this paper builds on incisive interventions by other Black women scholars. And these scholars' lived experience affirm that there is no view from nowhere whose claims to objectivity and universality survive close scrutiny. Rather, recognizing and reflecting on our vantage points strengthens our work. And so this paper contributes to the ongoing conversation about positionality, reflexivity, and knowledge production across several fields. And its sort of distinctive contribution is the attention to the role of institutional location. Most faculty work at teaching-focused institutions. And of course, most faculty are not tenure track or tenure. There are three experiences I'm going to highlight: what I term the white woman incident, the unexpected presence, and the repeat visitor. A white woman. When I was a political science grad student at UC Berkeley a long, long time ago, the department was male, it had no Black faculty, and had very few faculty of color. And so early on, I went to a practice job talk by a recent graduate. And she gave her practice talk, went through the Q&A, and then the faculty in attendance started giving the presenter advice. And one suggestion stayed with me. A white cis male professor told the grad to play up her field research more, saying something along the lines of, "You're a white woman who spent a long time in the field in Africa. That's impressive." White woman, Africa. What is it about the confluence of race, gender, and field location particularly impressive? I read this as advice to deploy that person's race and gender and the racist othering of Africa to her advantage on the job market. And I don't remember any of the other faculty objecting to this advice. This experience affirmed my sense that anti-Blackness was pervasive within the department and likely the discipline. I don't know whether the grad took that advice, but I do know that she got multiple R1 authors. I also inferred from this that my qualitative field research scholarship was likely to be discounted or devalued because I'm a Black woman, while knowledge generated by white scholars of Africa would be lifted up. The natives, whether they're African or diasporic, cannot know and understand themselves, especially if they're Native women. I went on to do field research in India, Uganda, South Africa, and Botswana, nevertheless, and to generate most of my data by talking with and listening to the people who live or work in the places I study. Being an unexpected presence. My first encounters with research interlocutors and participants in the early 2000s were often by email or postal mail before we talked on the phone and then met in person. And replies to my emails often addressed me as Mr. Turner, assigning me male gender, perhaps based on my name or perhaps because it was their default assumption. And then I found that gatekeepers and participants with whom I talked on the phone often inferred I was white. These are somewhat reasonable inferences given my Anglo name and the white maleness of most global North and South African university faculties at the time. So my Black womanness was unexpected. A land activist I interviewed in 2006, for example, told me, "I thought you'd be a white British man." This experience and others like it remind us that research is an interactive process in which both researcher and researched are observing and categorizing one another. I don't know how my unexpected presence affected research interactions, but I do know that we live in a patriarchal white supremacist world where white maleness and Black femaleness have very different valences. Return visitor. Most of my research has been multi-sited. I generate data about multiple polities and then think about them comparatively or relationally. I move between sites, spending days or weeks in one place before shifting to another site or city and then returning again to each site. I generated my dissertation data in this way, moving between 10 rural localities, Johannesburg and Gaborone. So I've always been a return visitor to my research sites, but my praxis and the meaning of being a return visitor changed when I transitioned from being a graduate student to being tenure-line faculty at a teaching-focused university. Cycling between places for 19 months is really, really different from spending a total of like 7 weeks in a summer or a semester in the continent, and sometimes having years pass in between visits, even before COVID. The length and the frequency of visits to old and new field sites matters. It's harder to build and maintain good working relationships with shorter and less frequent visits. And distance biases sustain communication towards the relatively elite. People's access to and use of WhatsApp, of email, and Skype or Zoom is tied to their location, whether they're in places with good or poor network coverage, to their income or lack thereof, and to their age, with younger people being more likely to be online in these ways. Now, lots of people say I only have summers, but this belies the substantial differences among faculty at different types of institutions and of varied status, whether they're adjunct or contingent or tenure. The teaching load, the ease or difficulty of securing course releases, research leaves, and sabbaticals varies widely, as does institutional support for research. These differences are consequential. Scholars who work at teaching-focused institutions or who have teaching-focused jobs confront more intense and severe trade-offs between field research, data analysis, writing, and the rest of life, particularly during breaks. And some ethical concerns are also heightened. I have a really strong preference for generating data through direct and humane interactions with people in the polities I study, but shorter and less frequent visits to these faraway places raise really hard questions about building ethical research relationships. And of course, this is affected by status and institutional context. People often suggest collaboration as a solution, but it's not necessarily a fix. We know that global North-South research collaborations are often extractive, and it's also the case that local hierarchies can mean that local researchers are less interested in marginalized people or interact in problematic ways with these folks. And non-R1 faculty have fewer resources with which to ease communication difficulties and or compensate community partners in ways that the relationship more equitable. So I want to close by just sort of noting that our experiences can provide a useful entry point into critical analysis of knowledge production. And I've used this white woman incident being an unexpected presence and a repeat visitor to highlight the interaction between our embodiment and our institutional location and how those might influence how we are received, are perceived, and how we do our research. So I'll stop here. Thanks.
Thank you, Dr. Turner. That was a great presentation. I look forward to the conversation it's going to start. I guess I'll continue right after, and I'm just going to share my slides. I think everybody can see my slides. So good afternoon, everyone. My name is Mahder Serekberhan, and as you can see on this slide, today my presentation is entitled Political Possibilities, Mobilization of Women in Sudan. So in 2019, we witnessed autonomous and non-hierarchical or horizontally structured networks of organizations led by women and youth subvert and challenge a military state. My paper highlights political possibilities, that is, the forms of participation and organization that have emerged as demonstrations turned into an insurrection. After 4 months of coordinated and sustained demonstrations, the leader of the regime, Omar al-Bashir, was removed. And after another 8 months, the military was forced to negotiate with civilian forces. So after Bashir's removal, the military had sought a transitional period with military leadership, but people refused, and sit-ins and demonstrations continued until the military conceded to civilian participation in the transition period. And various forces, including professionals, civilian and political groups, rebel groups, youth and women's groups, were responsible for exerting pressure on this 30-year-old regime. But since my focus is on the possibilities of a demilitarized bottom-up democratization process, I do not go into depth about the various and prolonged forms of organizing throughout Sudan, like armed opposition. Instead, my paper highlights 2 grassroots organizations, the Neighborhood Resistance Committees and the Tea Sellers Association. For the sake of time in the presentation, I'm just going to focus on the Neighborhood Resistance Committees. And the selection of these groups is also tied to my theoretical approach, which weaves the intellectual contributions of Black scholars and organizers like Ella Jo Baker, Andaye, and Amilcar Cabral, all of whom saw popular organizing and popular participation as central to political change and transformation. So the Sudanese population is an estimated 42.1 million, with 21.5 million being women. About 60% of Sudan's population is estimated to be between 15 and 30 years of age. The 2019 protests were largely populated by women who participated at all levels of organizing. Youth have been estimated to make up 80% of the protesters, whereas 70% of protesters in Khartoum, which is the capital city, were estimated to be women. There are no simple ways of designating people in conclusive racial, ethnic, or cultural categories, especially because such distinctions are related to historical, regional, political, and economic realities and histories. And last but not least, I want to highlight that the legacy of organized resistance in Sudan is deep, because 2019 was the 3rd popular uprising since independence in 1956, where the people have managed to remove a military regime. So to trace the 2019 uprising, I used this timeline in the paper. I won't go into it, but it begins in 2000 to indicate that the 2019 uprising is not an isolated event, but part of a continuous process, which continues till today. And the same can be said for most of the forces who are active in the uprising. So the first protests, which are indicated by the red dots on the 2012 map to your right, began on December 6th and had spread to Khartoum by December 25. And as early as December 23, as you can see to the map on your left, the diaspora were echoing these calls from France, Switzerland, South Africa, Egypt, and beyond. So the accounts of such distributed and simultaneous eruptions of popular protests not only indicate the conjunctures of the period, but they also show the scale, the rate, and the level at which popular participation was happening. So one of the most effective ways to organize became the neighborhood resistance committees. These committees existed since 2013, and they had worked on different fronts, including street cleanup campaigns, road works, school repairs, and equitable distribution of resources like flour and bread. And during the uprising, new ones were formed by people in the neighborhood. The committees became locally elected bodies, and their structures were replicated across urban cities and many rural communities. So when the Sudanese professional associations would put out a call for demonstrations, the committees would basically organize their neighborhood to respond. Many of the demonstrations in Khartoum, for instance, were organized under these committees. And the images you see here show the rate of demonstrations in Khartoum area. So by the time demonstrations had begun, Khartoum alone had about 30 active resistance committees. These committees, I would like to say, functioned as alternate political apparatuses that addressed the collective and basic needs of their communities, but they also managed to subvert the military. So for instance, if people from Wad Nobawi were out on the streets, I don't know if you can see that's one of the red dots on the map, but they were out on the streets and they came under the grip of the police and the security, they relied on the committee and the two other neighborhoods to hit the streets and take the pressure off of them. This not only affected the ability of the regime to repress protests, but as members expressed, it built camaraderie and collective security. So in my paper, I argue that unlike hierarchical forms of organizing with clear boundaries of leaders and followers, the horizontal and grassroots autonomous organizing challenged the militarized regime's power, and in the process, it created a non-hierarchical unity of the working people. So this form of organizing not only increased modes of politics, but it protected the autonomy of grassroots organizations that represented themselves. And this form of participation and organization that I'm attempting to convey is perhaps best exemplified through the sit-in that took place. So on April 6, 2019, a few days before al-Bashir was removed from power, the neighborhood resistance committees, along with other organizations in Khartoum, started this sit-in in front of the military headquarters. So the sit-in lasted for about 58 days from at least 9 cities across Sudan. Youth, women, students, unemployed, the professionals, and other different groups with like particular religions, particular races, age, and ethnic groups came together to form the sit-in. It drew so many people that security forces had barricaded roads and bridges entering Khartoum. So these realities kind of force us to complicate our thinking about the nuances and the collective power of the gender, class, race, and regional differences of those participating in the movement. The networks of people that mobilized and coordinated also shows complex movement and organization that transcend simplistic categorizations. And so the sit-in was transformed into a space where culture, art, politics could be observed and practiced. The black dots you see here indicate the limits of the sit-in, which altogether was an estimated 108 hectares. And as you can see on the figure, there were medical facilities, public toilets, food and drink services, and different security checkpoints. There were also educational facilities and a safe zone for women where legal and psychological support was being provided. The space was used to disseminate information and update people on the ongoing negotiations between the civilian and military groups and government. And in this sense, the sit-in became a space to practice a mode of politics built on popular participation, shared accountability, and collective contribution. And some have referred to the sit-ins as governing without a government. So we can understand why perhaps a few days later, we witnessed one of the deadliest attacks on the sit-in, which is now known as the Ramadan Massacre. This led to like the death of over 150 people, the rape of more than 70 women and men, and it also led to the disbanding of the sit-in. So, but this only further mobilized people, and a few days later became one of the largest national marches would take place, and the military would be forced to negotiate with civilian forces. So I'm going to conclude. This is my last slide. Over a period of 8 months, we witnessed like a new mode of politics with a participatory and representative model that did not exclude or relegate women and other exploited and oppressed groups in society, but instead benefited from their political agency and self-organization. We saw the power and necessity of alliances that can challenge entrenched systems and structures of oppression and exploitation. We saw at the sit-in the diverse communities, even those manipulated against one another, can build democratic relations and forms of governance. Different groups like the tea sellers, the neighborhood committees represented themselves and discussed with professionals and political groups at the state level. And these horizontal networks of multiple autonomous groups served as a strategy to challenge the state, its security apparatus, and its ideologies. Women and youth were leading at the grassroots and higher levels, and they asserted their political agency. All of which I argue has brought the possibilities of democratic political organizing and a multi-ethnic, multi-gendered, multi-raced, and overall diverse society. And that is it for my presentation. I hope I didn't go over time, but thank you.
Good afternoon. I'm just sharing my my slides. All right. So I am Dr. Francois Cromer. I'm a professor at St. Elizabeth University in New Jersey, and I am presenting my paper entitled Oral Histories of Antenatal and Neonatal Care Practices in Kawempe, Uganda. I'm a political scientist who studies medical health and wellness for Black women, and I've done this in the United States, studying Black women's policy advocacy for breast cancer research. Now I am studying women's health and experiences of pregnancy for low birth weight and premature infants. For the purposes of today's presentation, I will focus on the narratives and oral histories of 9 Ugandan mothers who had children under special care, their perceptions of the acute care their neonates received, the care they received during pregnancy, and whether the care was received in their homes and communities or in medical facilities. Okay. Neonates are babies born before 37 weeks with health conditions or with very low birth weight. Antenatal care includes blood pressure measurement, tetanus vaccination, urine testing, counseling about danger signs, HIV counseling and testing, iron and folate supplementation, early antenatal care, which is prior to 4 months gestation, and provision of at least 2 doses of medication to prevent malaria, which is endemic to Uganda or regularly found there. I seek to contribute to improving the quality of care for Ugandan women while reducing morbidity and mortality rates. For the first 2 weeks in January of 2019, I was the faculty advisor for a study abroad service learning program in Uganda, East Africa. We landed in Entebbe International Airport and were based in Kampala, the capital city. I supervised our visit to a neonatal acute care unit on January 7th, 2019. Did I just, no, I'm still on. I thought I got cut off. Okay. And Kawempe is an area in the city of Kampala, Uganda's capital. It also has the location of the headquarters of Kawempe Division, one of the 5 administrative divisions of Kampala. The referral system in Uganda is a national health system. All the mothers who shared their stories with me were at this hospital you see, Mulago National Referral Hospital, Directorate of Obstetrics and Gynecology in Kawempe. Mulago National is one of Uganda's top hospitals in the national health system. As a top hospital, it has doctors and surgical theaters like level 4 below it. And in addition, it has specialized care units There is supposed to be one referral hospital in each district, and staff are paid by the government. While I was concerned with research questions about the national health system from rural areas to urban areas, the mother's stories point to other concerns as well, including the high rates of maternal mortality during labor and delivery, the physical architecture of the hospital, including working elevators at referral hospitals and surgical supplies for doctors and staff, including simple things like the surgical gloves or refrigeration for blood. Also, the distance that women must travel to get to the hospitals or the next level up in the referral system, and the impact of these experiences of complicated births on their ability to give birth afterward. Neonatal mortality, which is death between 0 to 27 days of life in Uganda in 2016, was 27 per 1,000 live births. And in the United States in 2018, it was 33.9 per 1,000 live births. The maternal mortality rate in Uganda in 2016 was 336 per 100 live births, while in the United States in 2018, it was less than 21 per 100,000 live births. So during COVID-19, a total of 1,228 cases of maternal deaths were reported in hospitals in 2021, which is 11% higher than the 1,102 deaths reported in 2020, according to the Ugandan Health Ministry. The increased maternal deaths were primarily as a result of heavy bleeding after birth, with no or very little access to blood transfusions, hypertensive disorders of pregnancy, malaria, or other underlying conditions such as HIV/AIDS, anemia, and abortion complications. The World Health Organization's Sustainable Development Goals for 2016 to 2030 were to reduce maternal mortality to less than 70 women for every 100,000 live births. I asked qualitative, open-ended questions on care during pregnancy and after childbirth, but no identifying questions in order to preserve privacy. I also drew upon Ugandan newspaper, radio, and social media stories that had been written since the start of COVID-19, as well as government documents from the Ministry of Health, Republic of Uganda, the United Nations, and the Guttmacher Institute. Despite having 4 antenatal visits, the women did not receive all preventative services required. So the Ministry of Health, Republic of Uganda, and the WHO continue to research why maternal and neonatal morbidity and mortality remain high in Uganda, despite efforts to reduce them and their underreporting, with increased hospital infrastructure, medical equipment, and trained personnel. Oral histories, however, allow us to point to low birth weight, maternal complications, and short gestation as main drivers. Among women in Uganda who sought medical care for their neonates after childbirth, the 9 women came from poor households, and 6 mentioned having family support systems. In conclusion, focusing on oral histories of patients' perceptions of the antenatal care they received while pregnant, along with the care their neonates were receiving, shed light on possible interventions that might lead to continued improvement in the quality of care to mothers and neonates while reducing morbidity and mortality rates. So we have collective visions of healthy Black futures for mothers and their newborn children. And reading the transcripts of the oral histories, I realize now there are many questions that I would want to ask these mothers in the future. And some of those questions include the birth weight of the babies, the week they were born, the age of the mothers, distance of their home from the hospitals, follow up with mothers, but I didn't ask any identifying information. I would love to follow up with the children's development and later pregnancies and live births. Find out about birth experiences of children they had since 2019 and what other factors changed since COVID-19. Were there upgrades to hospitals? How many more hospitals were built? Services for pregnant women and newborns or neonates? And is there hospital or community outreach with midwives and doulas? So in terms of new meanings of state and global citizenship, I'm very interested in raising money for supplies and support to improve birth care at this hospital for newborns, including onesies, diapers, undergarments, cleaning supplies, window screen materials, more incubators, light therapy, so the bulbs that need to be changed, so each infant can be cared for in one, for mothers and family members, and also training for the support of medical doctors and nurses. Part of my practice as a political scientist of health politics ethics includes providing support for young families and visiting with the sick. Through these experiences, I often come across Black women in the United States, even those
Francois, you have 1 minute.
Thank you. Even those whose income is over $100,000 a year, who experience similar kinds of distress when preparing for the birth of neonates and preterm babies. I want to conduct a comparative research analysis with Black women in the United States who also have neonates, preterm babies, and full-term babies who die within the 27 days after birth. As other scholars of Black maternal death rates in the United States indicate, there are clear indicators that help explain high rates of infant mortality and maternal death rates of African American women. Sometimes these outcomes are mediated by ethnicity, so that Black women from the African continent and with a migrant or 1.5 generation background have a different set of social supports that promotes easier birth experiences, even with preterm and low birth weight infants. Thank you.
Thank you all for your papers. For the audience, thank you for joining us. These were all really excellent presentations and interventions. I will keep my comments very brief as well. I'll just start in the order that the presentations were given. I'll start first with Robin's paper and presentation. The issue that you are confronting and analyzing in your talk is very much timely, and it really speaks to, I think, what a lot of members of minoritized groups feel, particularly in the field of African studies broadly, but more specifically in African politics. And I really appreciate the 3 vignettes that you presented, and I think they highlight sort of what are the problems and issues that are commonly faced by researchers like yourself. I just have a couple of questions. The first one being, to what extent do the existing sort of methodological fault lines, to what extent do they also amplify what you're talking about? Right, because I know that there's this major methodological division, at least within African politics, and this is longstanding, and so you have sort of a hegemony of a certain type of tradition that exists right now in that subfield. And so, to what extent do you think that intersects with sort of these exclusionary practices that you talked about? Second, also, if you could just talk to us about what are the perceptions and receptions of yourself by locals in the African countries you visited? I'm curious about that because, as a Black woman that was doing field research in South Africa and Botswana and beyond, how did locals receive you? Because there is also this, global South, global North divide. But because of your racial background and your gender, clearly, you're able to transcend that. But does it also translate to those contexts? Do people see you also as an outsider, or do they see you as more proximate to them? Because I've heard arguments in favor of both positions, right? I've heard that as a diaspora Africans, we have an advantage when it comes to doing fieldwork in Africa. But I've also heard the opposite, which is that Anglos have an advantage when it comes to doing research in Africa. So I'm just curious where you come down on that question. I will also, I'm going to jump to Françoise's presentation because I have more substantive comments for Mahi. Françoise, I also enjoyed your presentation and your research. I was mentioning to you the other day how the issue of maternal mortality among African-American women has been in the headlines more prominently in recent years, right, as a result of and after Black Lives Matter. And I'm really glad that there's more attention being shed on this. And I know that you mentioned that you want to look at the connections between diaspora women and also women in the United States, which I think is a really great research agenda. I'm going to ask you a question that I asked you in person, but I think the audience could benefit from it as well. What are the prenatal practices that are available for Ugandan women? So are there doula or midwife services available, or do most women tend to have births at the hospital? And if so, what are the implications of that? Perhaps there's like a class element to it that I'm not aware of. Are doulas and midwives something that are just reserved for the more wealthy women, or did you notice any type of trends like that is what I'm curious about. Also, your study focuses on cases in Kampala. And I know at the end of your presentation, you said that you want to expand out and you want to focus also on other questions to follow up. But in your follow-up, do you also intend to talk to women from other parts of the country, right, in rural areas? Because I know that Uganda is heavily rural country. Do you intend to do that type of a follow-up? Because perhaps, you know, there will be similarities and maybe there will be differences that are unique to women that are in the rural parts of the country, because I know that service delivery is a major issue, especially in rural areas. And just what are the experiences of women and maternal mortality in that part of the country? But thank you to both. For Mahi's paper, I really enjoyed reading your paper. I feel like it focuses on the remarkable events that happened in Sudan and its uprising in 2019. I feel like it does a good job of focusing on that. I also like the fact that it provides the micro dynamics of regime change, because you have this period of time that is almost utopic, right? It's this brief moment of like democratic possibility in Sudan that unfortunately did not last very long, right? And so you do a really good job of capturing the atmosphere in the country, on the ground at this time. And so I also have some specific questions about the paper for you. So for one, you argued that one of the grassroots organizations in your study, the SPA, that it played a central role in organizing the uprisings, and that its strength lay in the ability to reach grassroots organizations and working people. And on page 8 of your paper, you mentioned that one of the ways that grassroots organizations were organized sort of ensured that the uprising would not be quashed the way that it was in 2013 and 2014. And so I'm just curious about what was the difference for 2013 and 2014, if you could talk about that. Second question, you discussed the gendered nature of women's activities in these grassroots organizations. Did women have any leadership role in any of them, right? And did the major organizations like the SPA, did they have a gender egalitarian vision of what post-revolutionary Sudan would look like? So I think if you could add that to your paper, that would definitely help. And lastly, I don't know if you have time for this, but if you could just put Sudan in context with other uprisings and revolutions, because you're really saying that these grassroots organizations were pivotal to the success of the uprising, but what makes Sudan unique as well is one thing that I'm left wondering. But thank you to all. And these are just questions that are meant to structure the discussion. I also invite the audience members to add on as well.
Thank you, Dr. Farole. I think those were amazing questions. I'm not sure, like, in what, how we should go about it. Who should begin?
Please feel free to. Go ahead. Mahi,
So I was
you can
just going to
answer.
ask whether we should also see if there are other questions we want to add to this from the audience, or.
That's a good idea, and you all can respond to them maybe collectively. So why don't we do that? Audience members, please feel free to ask or in the chat as well.
guess I can start answering the questions, and then if audience have like questions, they can put it in the chat or something, or feel free to also stop me. So thank you so much for your comments, Dr. Farole. I appreciate it, and your like in-depth reading. The first question you asked me is that like, what was the difference between this form of organizing versus what we've seen earlier, right? So the SPA wasn't what you would call a grassroots organization. It was a professional association. So it was the Association of Unions, but it had like reach to these grassroots organizations that I particularly want to look at. And so what the difference was is first, like in the previous, if you're looking at the 1964 uprising, 1985 uprising within Sudan itself, which you would call a popular uprising, was led by these kinds of unions and whatnot, but you didn't have an organized grassroots movement. Whereas at this point, we're looking at the neighborhood resistance committees had been organized, they were ready. So they had already formed in some places, and their structure just got replicated during the uprising, as opposed to like that existed. Whereas in the previous uprisings, you're looking at the leaders are clearly the professionals, and the grassroots are responding, but not in an organized manner that we're seeing. So I think that would be like one difference as to like how the grassroots played a role. This time they were organized and they represented themselves at the state level even. So who the group that ends up negotiating with the military is the Forces of Freedom and Change. And this is a body of like all the civilian members, including armed oppositions. And within the neighborhood resistance committees I discussed were present as a represented group within the Forces of Freedom and Change. So even the Tea Sellers Association, that wasn't an organization that was formed during the uprising. It was formed before, but it played a role as an organized body, right? It was also part of the Professionals Association. It represented itself as a union. So we're really looking at what you call like grassroots politics being represented at the state level as it stands, as opposed to like it has evolved into something else. And so for your second question, the gendered nature and grassroots activities, yeah, I don't go into this paper because this paper is like part of a larger work, but whether you're looking at the top people in the SPA, they were like women like Sarah Abdul Qadir, like they were basically women at all structures of organizing. The SPA, some of their top people were women. The grassroots organization I'm talking about, the neighborhood resistance committees, many of them were formed by young women in the neighborhoods. So at whatever level of organizing you're looking at, there were women present. And there were times like what you pointed out, there were times where, for example, when the transitional body was being formed and there was like a conversation about a legislative council being formed, there were no seats or quotas for women. So you saw women who were in the SPA, part of this large coalition of professional bodies, push against this. And so what we did see is like even in instances where a gendered vision wasn't being, there was pushback because we're looking at so many levels of organization. The grassroots of women's are organized, but they're also present in these like state level negotiations. So we did, I don't want to say there was this radical gendered vision, but whenever there was enough organized women's groups that were pushing for it to be. And because of Mansum and some of these coalition groups I don't discuss in detail, you have like the Legislative Council took up like 40% of the quota would be saved for women's seats, basically. And then your last question, Sudan in context to other organizations. So these kinds of like grassroots organizations we've been seeing, in general, I want to say like what we have seen in Sudan in 2019 is something similar to what we saw in Soweto like 45 years ago. And then again in Egypt in 2011, it reflected the mass character of the countries, right? It was like literally everybody who represented a particular group in society was out working towards political change. What's different about Sudan is the level of organization, which today, if anybody looks up Sudanese politics, when I was researching this, nobody was talking about like resistance committees. But today the resistance committees are so organized that the UN is trying to have meetings with them in terms of how to deal with like state level politics. And so what we're seeing in Sudan is like the level of organization, perhaps because of the historical legacy of organized movements in the country, or perhaps for other reasons I'm yet to research. This is like part of my larger dissertation project, but it's very distinct in like these grassroots movements are organized and they're autonomous. Like the neighborhood resistance committees in Khartoum are very different than the neighborhood resistance committees in Darfur. They stand for different things. They're coming to the table with different ideas. They're coming to the table with different charters, each kind of just, so you see that self-organized, self-articulated representation happening. And they're still organized, and there's still like, since October 2021, the military attempted to take over the transitional government. It was called the Sudan coup, but you see people are still refusing. So there's a consistent struggle happening because of how organized the people are and how these coalitions are forming. Powerful and what we would consider not powerful groups are networked and are organizing in coalitions. So in a nutshell, I think Sudan is particularly in terms of how organized and the kind of level of organizing we're seeing, it's unique.
Excellent. Thank you so much, Mahi, for that response. Why don't we go ahead and jump to the other presenters? I'll start with Robin and then Françoise. For audience members, please use the raise your hand button to ask a question, to indicate you want to ask a question, or put your question in the chat. Thank you.
Okay, so thanks. I'm going to first thank Safia for such thoughtful comments. And also it was a pleasure to hear and learn from everyone else's paper. So I think your first question was about the extent to which existing methodological outlines amplify what we're talking about. Absolutely, they do. I'm going to talk about this in two different ways fairly briefly. One, if we think about this divide between quantitative and qualitative, but also positivist versus interpretivist, these sorts of fault lines provide a strong incentive for people at institutions where they're teaching a lot or don't have much research support to do work with already existing data that you can get without traveling, and that puts you more in the sort of quantitative pool. So there's that sort of force happening. But at the same time, particularly for the prestigious journals, what they're demanding in terms of evidentiary standards, in terms of how you're supposed to support an argument, has really ratcheted up the cost of research. And I think that shows up in some ways more for quantitative work. And so that ends up screening a lot of people out. So I think it's sort of pulling in both directions. So I think your second question was around sort of perceptions and receptions of myself by locals. And this is something that I sort of have thought about and written about some more in other contexts and continue to think about. But I guess what I would say is I think there are a whole host of factors that shape how we're received. And so race and gender are part of it. Also how we present, all of these sorts of things. And my experiences in South Africa have been different from those in Botswana, I would say, and I have much longer relations, I'd say, with in general in my South African research sites. In the ones that are in former Bantustans, I've been able to develop some fairly long-term relationships, but always still, I'm this person that comes and goes and returns back. Some of my work has been around tourism, and because of that, the people that work in and around that have these experiences that are not always great experiences, but experiences of interacting with Black, white, and other well-resourced folks. And so I think that also shapes how I'm received. I did some work in formerly white areas, and that is definitely a place where my race and gender were real barriers to building productive relationships with some key actors. I think there's a lot more with that, but I will stop so there's time for our third presenter to say a bit.
Thank you, Robin. Françoise, go ahead.
I just want to really quickly thank you, Dr. Farole, and thank Daquan Lawrence and the other co-presenters for such an excellent panel. So the first question you asked was about midwives and doulas. when I was there, I spoke to 10 women. I don't think I spoke to any one of them longer than 10 minutes. And I did share the transcript, and I'll just put it back up so that you can see it real quick. They did mention where they had, where is it? They had one or two used the word midwife, but they definitely said the community women. See this one in number 9, she talked about using local herbs to bathe in the morning. She would chew herbs like roots. So she was clearly getting care from community members in her area. There are others, let's see. This one I think was having seizures, but I think that, is she the one who said she did not go? There was one who said, I did not go to any community members, but there were others who said that they did. There was one who talked, it was interesting to me, about getting a massage to turn the baby around who was breech. And so it was, here it is, the women in the community did that for her. So they did talk about using community resources. They didn't always name them as doulas or midwives, but they did talk about that. But at the same time, they were so thankful for this referral system. And so that gets to maybe the other question that you asked me about with the rural area. Uganda's national health system, which is totally different from the private, right? I think the wealthy women use the private healthcare. They don't go to the national healthcare hospitals or different levels of healthcare through the national health system, which is what I was looking at. So there are 5 levels, and the first level is for rural women. And if I get a chance to go back and do this research, I would definitely look into it. But for someone in a rural village, their first point of contact is a member of a village health team, VHT. So every village is supposed to have people who can distribute medicine. I don't think that's the case. And one of the reasons why maternal mortality is so high is because during labor and delivery, if anything happens, they have to get the woman in labor from her village to the next level up, or to whatever level they deem that person should go to. And it's during that transport, which is why I said that's one of my concerns, is the transportation and the distance, that women may die, or if they're at a level 2, 3, or 4, if there's no refrigeration, because many more of these structures have been built in what we would call rural areas. But if they don't have a refrigerator, they can't store blood. And what is very common is excessive bleeding. And if you don't have blood for a blood transfusion, or if you have to do surgery and you don't have surgical gloves, which also, as we all know, during COVID, supplies were scarce. And of course, we know the continent was not a priority. So if they didn't have their own context, what were the rural communities going to do? So, these are some of the major concerns. But the one wealthy woman I spoke to went to private hospital and had her baby. Did I answer the questions?
Yes, you did. And that's really a great additional information, because I had suspected there was this type of public-private divide, but I'm glad you confirmed that.
Definitely.
Yeah. For the audience, we have 2 minutes. Does anyone else have additional questions that they'd like to ask the presenters? Or if you'd like to drop it in the chat box as well, I'm happy to read off from there too. Yes, Miranda, please go ahead.
Okay, cool. Yeah, I'll try and make this quick. Sorry, I couldn't put in the chat because it was taking me a while to formulate it. So yeah, this is based on the presentation on the Sudanese uprisings. So I'm just interested in, because I think sort of mainstream characterizations of the broader movement as, this being anti-military rule So just interested kind of, to what extent, yeah, I'm sure even, people, that's what they think and stuff, but are there other sort of ideological threads that are coming out, other narratives and demands that people may have in terms of, the Sudan that they want to see?
Yeah, thank you so much for your question, Miranda. Yes, definitely. I mean, Sudan has a strong history of like, Marxist, Leninist movements and political participation. So you have that branch of ideology. You have a growing like anarchist movement among the youth in Khartoum. But here's the thing, this anti-military rule is a clarity all groups have, right? And so when they come into coalitions and stuff, different groups tend to like stand for different things, especially because of the nature of like regional differentiation itself. Like different regions, depending on your race, depending on your ethnicity, depending on your gender, you've experienced something particular. So when you're looking at like Darfur and Khartoum, the kind of issues, whether it's this lack of social services, whether it's a militarized kind of extraction from their regions, is very different to what their experiences are. So you definitely have different groups with different sentiments kind of coming together as one. But the clear like thread you see that they're all clear on, especially at this point where we're seeing like protests right now, is that they don't want the military in any form of like state rule at this point. And so that's been a clarity that there's been like much of like, I don't go into detail, but when you saw the sit-in, there was refusals of like, Saudi and the UAE kind of said, we are going to give the military 300 million. And there was an outrage in like the sit-in saying, we don't want money. So there's anti-imperial sentiments there. So there's a lot of threads, but I would be unfair for me to say like they all agree on everything. Definitely don't. These are fractions. We've been seeing some coalitions have fallen apart since 2019. Some have formed anew. So you're seeing people are struggling with different ideas, but the clarity has been like, we don't want military rule anymore. We want civilians to lead. And even there's been talks of like restructuring the military as a whole because it emerged from a colonial context.
Thank you.
Thank you, Miranda. Thank you, Mahi. I want to be sure we respect the time, but is there anyone that has burning question left? Because Daquan, our chair, had to leave. And so, but it's no problem. I just want to make sure that the audience is getting all their questions answered. I don't see any additional questions in the chat. I also don't see any raised hands. So with that, we can conclude the panel. I really appreciate audience members for coming and joining us today. Wherever you are, for me, it's morning time. For some of you, it's afternoon. I also really want to thank the panelists for fabulous presentations and for fabulous papers. I want to thank Dr. Turner, Dr. Françoise. I want to thank Cromer. I also want to thank Mahi. I really enjoyed all of the presentations, and I look forward to seeing where your projects evolve. Thank you, and have a great rest of the day for everyone.
Thank you, Dr. Farole.
Thank you.
Great panel. Thank you.
So,
are you all still here? I just wanted to say goodbye to you all again, our panelists.
okay.
Thank you.
Thanks.
And all this work is super interesting. It's like I want to read,
We
see where all the projects go.
We should definitely try to, get these papers published. I don't know if you all already have